Hello, I'm Graeme Sherriff from the University of Salford School of Health and Society. As part of the Sustainable Housing and Urban Studies Unit, or SHUSU, we worked with colleagues in the Western Isles of Scotland to study a project that connected energy poverty with long-term health conditions. In this presentation, we're going to tell you about that project, the impact it had, and consider the implications for decarbonising housing on the islands. I'd like to hand over to Brian to introduce himself and tell us more about the project and the islands.
Hello everybody, my name is Brian Whitington. I work for Tyne and Shigal, which is the housing and energy agency for the Outer Hebrides of Scotland, made up of 15 inhabited islands, a population of 27,000, and all living on the far northwest coast of Scotland. We have issues that are directly linked to where we are, which is the higher energy costs, and that's because we're literally at the end of the national grid. We have weak grid connections brought on by the severe weather that we often have in the winter, which literally blows down power cables. We have relatively poor housing conditions based upon the age of the housing stock and the fact that most of it is uninsulated. Our demographics are that we have a sizable chunk of older folk, and we also have relatively low incomes based on the type of employment opportunities available in the islands. And all of those together come in to form the perfect energy storm, which creates levels of fuel poverty of 56% under the old definition of 10% of your income spent on fuel, or under the new definition, which is much harder to explain, that comes out to 43%. So it's basically a disaster area for energy poverty in our. So we brought together agencies to try and overcome this, and we inextricably linked services so that if somebody has, for example, a medical condition which is exacerbated by fuel poverty and poor living conditions, then the NHS were able to work closely with TIG to be able to try and do something about that. There were specific instances of people who are very vulnerable, and those are people, for example, who have mental health issues or who have drug or alcohol addiction issues, and that leads to further complications in the home connected to fuel poverty. The Western Isles Citizens Advice Bureau also joined our project, and that was to do with linking in debt advice and things like that. So our partners were the NHS, the Western Isles Association for Mental Health, the Shed, which dealt with drug and alcohol addiction issues, and the Foyer, which worked for young people who are vulnerable. The principal aims of our project really were to bring everyone together. The material changes we sought to make were what you see on this slide. We have types of houses here where we call them room in the roof, where people have 1.5 story properties. So in effect, all of the lofts are living spaces. We also sought then to internally insulate walls, underfloor insulate, loft insulate, put in reflective radiator panels behind radiators, and install draft proofing. One of the ways we sought to do this was to go out and talk to people in their homes and find out what their circumstances were. So we had a team of people whose job it was to go to each of those houses, find out what was going on, and those households were referred by one of the partner agencies.
The research team worked alongside TIG to study the process behind working together and the impact of the project on householders and participating organisations. We conducted a survey of householders and interviewed them about their experiences and the support they had received. We also spoke to a range of stakeholders in TIG and partner organisations and to health professionals. We worked with them through the workshops shown here to review and consolidate our findings. Through the analysis, we were able to evidence the range of support across a large area geographically, as shown by the dots on this map, and reflecting a combination of advice, financial support and physical improvements. As researchers used to working in urban areas where fuel poverty programmes can sometimes benefit from the economies of scale of similar housing stock in close proximity, we were struck by the remoteness of much of the housing, and unfortunately by the poor quality of much of it. Householders told us about the ways in which this situation, coupled with the harshness of the Hebridean winter, has profound impacts on their health. The remoteness also makes the job of supporting households especially challenging, with staff from TIG and other Moving Together organisations routinely having to make long journeys, crossing from island to island and staying overnight to cover the area. As shown here, mobile banking and library services were essential to many people. Our discussions with householders and stakeholders involved in the project demonstrated the ways in which this person-centred multi-agency approach brought benefits to vulnerable residents. Householders were positive about the support they were receiving and the effect this was having on their lives and on their health. Debt is a prominent issue on the islands, and householders were helped to be debt-free, some for the first time in their adult life. In this example, the stakeholder talks about the profound impact this had on one person's life. Another told us that they were now less anxious, householder that is, told us that they were less anxious about the deterioration of their home. Another of having more confidence to use the heating when they needed it without having unexpected bills or getting into further debt. Another mentioned no longer having to rely on an expensive portable heater now that they had a heat pump installed. Another householders mentioned during storms, which are common on the island and can be severe, they noticed they no longer had to flee downstairs to the sofa because the upstairs of the house was so much better insulated. And another mentioned being able to keep the house better organised simply because it was more evenly warm, so it was just much easier to do stuff in the house and keep on top of things. Another, and some of these will be familiar to fuel poverty researchers, another mentioned not having to worry about guests being cold because the upstairs of the house and the spare room was much more hospitable. And another final example is a man who was able to transform his personal mobility through acquiring a car by saving money on his household bills. And he commented here, he's speaking in his quote, about how you're much more independent, especially with limited public transport networks on the island. And this enabled him to more reliably attend hospital appointments, to do more during the day instead of just spending lots of time on buses. And that improved his social life and his access to shopping and other services. Whilst the benefits to householders were profound, the impact of the project goes beyond this and extends to the way it started to transform the networks that were offering support across the islands. Receiving messages around energy and housing through trusted health professionals really helped to make sure that householders would accept this support in a way that might not happen if it was from unknown organisations or contractors calling at the door. And this trust was transferred across the network, so that if organisations were used to receiving support from one of the other Moving Together organisations, for example, this trust could now be transferred to TIG, creating opportunities to build on existing relationships rather than starting new relationships simply to talk about energy issues. Conversely, and shown by the second quote here, other organisations in the project found it beneficial to be able to refer people onto TIG when they didn't have the knowledge about issues such as energy and housing and insulation and technology and so on, or indeed the time to discuss these in detail, nor the access to funding and contractors who could provide improvements to their homes. Nevertheless, these were often the people, such as healthcare workers visiting people's homes, who really knew when people needed support with energy and housing issues. Moving Together wasn't about reducing carbon emissions, it was about improving health and helping people be warm. Sometimes this meant helping householders to use less energy, and sometimes it meant providing financial and other support to help them use the energy they needed for their health and well-being. The project is part of TIG's wider programme of work directed at housing and sustainability. TIG are invested in decarbonisation and are working with local government to establish area-wide plans to systematically improve the energy efficiency of buildings and decarbonise heat. This responds to government targets in Scotland to both reduce fuel poverty to no more than 5% of households and extreme fuel poverty to no more than 1% of households by 2040, and to reach zero emissions by 2045, as shown here. It is important then that we consider the relationship between decarbonisation and fuel poverty, to think about how TIG, with its reach across such a large area, can respond to both these agendas.
The main way we're going to deliver that strategy, however, is coming back to how we deal with housing stock, and that means if we wish to install heat pumps, for example, we have to insulate those properties. If you install a heat pump system into a house that's uninsulated with leaky windows, you will in fact raise fuel poverty. So in order to meet those two policies, the decarbonisation through the local heat and energy efficiency strategy and the reduction in fuel poverty targets, that means we're going to have to insulate thousands of homes. Now, because of the types of properties we have in the islands, that means often external wall insulation. External wall insulation on the house that you can see on this slide cost about £10,000 or €11,000. So you can do the maths if you have to do thousands of those just for our islands community. For the whole of Scotland, that's a lot of money. I want to just talk briefly here about unintended consequences. This is my colleague Martha visiting a property where the gentleman had high heat retention storage heaters installed by the government. Great. They spent £6,000 installing these systems, but they didn't tell him how to use them. And that meant that he then bought a propane gas heater that he wheeled around his house, turning off those systems which had been installed for him by the government. So my main message there is you can have policies, but unless you talk to people in their homes, you will never find out how best you can help them and how you can make decarbonisation fair. So they put in that system there. They didn't tell him how to use it. He turned it off. He bought in a propane heater with all of the emissions. And of course, the water content in his air in his property went up as well. So that caused damp in his home. So think about that when you're looking at policies and how you deal with real people. And that is, you talk to people, you inform them so that they can make informed choice. You then give them the capability to make decisions on how they can make their homes more efficient, and also then how they can do that affordably.
And that's a powerful example of an attempt to help someone benefit from a heating system, but with unintended and, in this case, high carbon and high cost consequences. As we rush to install new low carbon technologies, we can take note of the importance of ensuring that residents understand and can get the best out of their new homes. Otherwise, we neither alleviate fuel poverty nor achieve decarbonisation. Such an approach requires careful coordination and funding not only for technology and installers, but also for staff to work with householders and understand their needs and priorities. TIG's Moving Together project is an example of an approach in which agencies across health, housing and the voluntary and community sector work together to sensitively engage with householders and work with them to secure energy-related improvements and provide support to get the best out of those improvements. You can find more about the work in the project report and the TIG website as shown here, or by getting in contact. Thank you for listening.